This is a lesson 4, More Diseases Affecting Cattle video. Our what for lesson 4? I can learn about and explain the diseases foot and mouth disease, myocarditis, and foot rot, which can affect cattle. And 2, I can learn about and explain how these diseases are treated and prevented. Why? In order to properly care for and support the health of our cattle, an understanding of the diseases FMD, myocarditis, and foot rot, which can affect cattle, is needed, along with their treatments and preventions. Lesson 4, cattle vocab. Do you know these lesson key terms and their definitions? Our lesson 4 key terms. The key terms are on the left, the definition on the right. Number 1, lesions. And our definition is a part of the skin that has an abnormal appearance compared to the skin around it. We have an image there of a cow's tongue. We can see 2 lesions on that cow's tongue. Those red spots are abnormal tongue tissue compared to the skin around it. 2, cloven hoofed. There's a picture there. We can see that the hoof is split into 2 toes, so to speak. And our definition is animals that have hooves split into 2 toes. That's what a cloven hoofed animal is. For example, cows, sheep, goats, pigs, deer, llamas, alpacas, buffalo. 3, myocarditis. And our definition is an inflammation of the heart. 4, foot rot. And there's a picture there that also shows nicely the 2 toes of a cloven-hoofed animal. A term used to describe a hoof infection in cattle, sometimes used to refer to any inflammation in the foot of a cattle. And then 5, foot and mouth disease. And we can see a pustule or blister associated with foot and mouth disease in the mouth of this cattle. This is a contagious virus that affects cloven-hoofed animals like cattle, swine, and sheep. Those are lesson 4 key terms. All right, here's a practice question. Cattle. Cattle are at risk of which diseases besides BSE? Cattle are at risk of diseases such as foot and mouth disease, myocarditis, and foot rot. Besides BSE, bovine spongiform encephalopathy, cattle are at risk of these 3 diseases: foot and mouth disease, which is caused by an extremely contagious virus; myocarditis, if foot and mouth disease is very severe and the cattle is young or old, they can develop myocarditis, which can be fatal. Myocarditis is associated with severe FMD infections. Foot rot, this is not a contagious disease, but it is extremely painful. This is often first an injury and then secondary infection. These are 3 diseases, disorders cattle are at risk of. All right, ready? Comprehension check. Which diseases or disorders are cattle at risk of? Cattle are at risk of the disease foot and mouth disease. How does this infection happen? What are the symptoms? Foot and mouth disease. This disease affects any cloven-hoofed animal. It's not just something that can affect cattle, but any cloven-hoofed animal is at risk of this disease. It's an extremely contagious virus. Most animals do recover from this disease, but this disease does cause huge economic losses. How does this infection happen? This disease spreads from infected animal to any animal nearby. Infected sheep can spread it to cattle nearby. Wild deer can have it. Wild deer nearby any farm can spread it to those cattle. Wild hogs can spread it to any nearby cattle or any nearby pigs. This can also spread through contaminated materials. This virus can stay active for days in bedding, in stalls, in pens, in vehicles, in trailers, in water buckets. It can remain active on human clothing, on human footwear like boots. This infection is extremely difficult to control, and it's extremely difficult to eradicate once established because it does remain active for so long, and it's so easily transmittable from any material through so many animals and through so many methods, through air, through water, through moisture, through saliva, through clothing from humans, through animals. What are the symptoms? The symptoms are lesions on tongue, lips, hooves, and mouth. After lesions appear, next comes a high fever. Then there is excessive drooling. After that comes weight loss and then lameness. Which animals can get foot and mouth disease? Any cloven-hoofed animal can get foot and mouth disease. Question: an entire county. What are the treatments? What are the preventions for foot and mouth disease? Many vets say this is the hardest infection to ever get rid of. Animals can carry and spread this virus and never show any symptoms. An animal can carry this virus and be asymptomatic. Most animals will show signs of this virus if they are infected with it around the third day. But there are some animals that can carry this virus for many, many, many days, months, and never develop any symptoms and spread this virus to other animals and never show that they have it. Another reason why this is such a very, very contagious virus and a very, very difficult disease to get rid of and prevent. There is no specific FMD treatment. The symptoms of the animal are treated, the sores, the fever. The key is disinfection of bedding, stall, pen, etc. Strict sanitation needs to be put in place and repeated daily, again and again. Prevention is key. There must be a sanitation protocol put in place at the facility. The last outbreak in the United States was in 1929. So we have not had this disease in terms of an outbreak for many, many decades. We also have a vaccine bank in the United States so that if an outbreak does occur, we could produce a vaccine within 1 week if needed. We do keep a vaccine bank for multiple strains of FMD so that if an outbreak did occur in the United States, we could produce many vaccines for cattle within 1 week if needed. All right, let's try this practice question. You got it. I knew you would. Some infected animals do not show any symptoms, so some of the other cows may be infected as well. So all cows need to be quarantined. All right, number 2, myocarditis. How does this inflammation happen? What are treatments? Are there preventions? Cattle that do have foot and mouth disease. If this is very severe and the cattle is young or old, watch out. The foot and mouth disease virus can end up causing myocarditis. Well, let's think about part of that word, myocarditis. C-A-R-D, card. Cardio, what's cardio? When you do cardio exercise, what are you working out? Well, that is a picture of a cow's heart, and there are some certain areas being pointed out that are of concern. This is inflammation of the heart. This is a problem that occurs with the cow's heart. It's secondary, it's caused by the foot and mouth disease virus. If the FMD is particularly severe, and especially in cattle that are young or old, that FMD virus can cause myocarditis. Well, what's the prognosis? Many cows can recover from myocarditis after several months of treatment, but some will not. Myocarditis can be fatal. What's the treatment? Well, there are prescribed medications. Digoxin and diuretics are prescribed by the vet. What's the prevention? Well, the farmer or the facility manager should take measures to prevent FMD in their cattle. They should have sanitary measures in place. They should have pens and stalls that are kept sanitary. There should be sanitation protocols to prevent FMD, because FMD is not just a disease that causes lesions and problems with the foot and mouth, but it can lead to myocarditis. All right, here, let's try a practiced question. All right, number 3, foot rot. How does this infection happen? What are the symptoms? Foot rot, hoof infection in cattle. This is not contagious. It's not a contagious disease, but it is very painful. This is something that happens where the cattle's foot or hoof tissue actually rots away. What happens first is there's an injury to the hoof of the animal, such as a scratch or a crack in the skin. And then second, there's an infection. Bacteria enter this wound in the hoof or the foot. Most often, it's the bacterium Fusobacterium necrophorum. What symptoms occur? There's swelling of the foot. There's lameness, which is inability to use the foot. If it's true foot rot, there is a foul smell. As this condition advances, the cow raises its infected foot, refusing to use it, refusing to move. It loses weight. If it's not treated, the infection spreads to the tendon, to joints, and to deeper structures in the foot, the hoof. And eventually, it may have to be amputated if it's not treated. What are the treatments? What are the preventions for foot rot? Well, foot rot occurs when there's wet weather, when there's humid seasons, when there are moist conditions. Otherwise, it's generally random. Having a housing system where you can keep cattle dry helps decrease the chance foot rot occurs. Foot rot does affect the animal's ability to gain weight and produce milk, so it can affect the economic bottom line. So the farmer does want to make sure that you can have a cleared lot, a dry area for the cattle. Lots should be well drained. There should be no standing water. Any pasture area should be kept free from any material that could injure hooves. There should always be a housing system to keep cattle dry. That can always help prevent foot rot. If cattle do develop foot rot, they are going to be treated with antibiotics plus a topical ointment. There's going to be regular cleansing of that hoof. That hoof is going to be wrapped and it's going to be kept dry. All right, a practice question. All right, after we finish, where are you at with number 1 and number 2? Are you farther to the right? Number 1, I learned about and can explain the diseases: FMD, foot and mouth disease, myocarditis, and foot rot, which can affect cattle. Number 2, I learned about and can explain cattle disease treatments and preventions. Can you check these off? I hope so.